Good afternoon, everybody. Thank you, Mayuram, for giving me an opportunity to do this small presentation on Ebola, which has created an exaggerated healthcare crisis, exaggerated in the US. Okay? Does anybody know anything about Ebola? What do you know?
It was from Africa.
Oh, good.
Yeah.
What do you know?
That your internal organs bleed and you have
Okay, that's good. Huh? That's true, that's true. That's true, yes. I can't hear you, please. Spread by? Oh, okay. That's true, yes. Oh, good. So, the name of the disease came from the Ebola river, where the first outbreak of Ebola happened in the early to mid 70s. So, the first outbreak was in Republic of Congo, and the recent one in the West Africa, with Liberia and Sierra Leone. Okay. So it's given the Ebola, the hemorrhagic fever. The word means it can cause bleeding and rash, which will be really red, and in the later part of the disease, it can start bleeding. That's usually towards the advanced stages. Any questions? You can interrupt me at any time for questions, okay? So how does Ebola transmitted or spread? You're right. It can be only spread by the direct contact with the body fluids of the infected person, or the contaminated needles or any equipments. So, when a person can spread the disease or when he becomes infectious, only when he has symptoms, he or she has symptoms. Okay? Ebola is not airborne disease. Does anybody know what is airborne disease? Yes. Okay. What is? Yeah, that is close. Yeah. What is airborne? Did you raise your hand? That's true. That's the exact answer. Actually, okay. What is your answer? Yeah. Yeah, that's true. Yeah. Airborne diseases are where the bugs like bacteria or virus stay in the air, and when you inhale the air, you can get the disease. That means you don't have to have direct contact with the infected person. Whereas the droplet, that means a fluid in the big droplet, like when you cough or sneeze, that may have the bugs like bacteria or virus, and that will fall on your eyes, mouth, or broken skin, can give rise to infection. So usually the tuberculosis or like some of the plague, they spread by droplet. The flu spread by the airborne. You don't have to have direct contact. So Ebola is not airborne. That's a big relief. Okay? So in US, Ebola is not transmitted by airborne, not by contamination of the water, or by eating the food which is legally grown in US and cooked properly. Any questions so far? What's your question? question there. Okay, let me move. Maybe we'll talk later about that, okay? So, symptoms of Ebola. Does anybody know what are the symptoms of Ebola? Okay, what is it? Yes, correct. Yes, that's true. Yeah. So how soon one get infection after exposure to the virus? The incubation period, that's the term, the technical term used. The time period from the exposure to the virus or the bacteria to the onset of the symptoms, that's usually average is 2 to 21 days. You get the disease in 2 days if the viral load is so high. Otherwise, up to 21 days. That is the reason the quarantine period, that means isolating somebody for the period of 21 came based on this scientific fact. Okay. Any questions?
How do you prevent Ebola?
Oh, we are coming to that point. Good point. We'll come, okay? So the average incubation period they noticed in Africa was 8 to 10 days. Usually the bleeding or the hemorrhagic complication occurs more towards the late stage or when the infection gets so severe. So the common symptom, most common symptom is fever, high fever, muscle pain and feeling tired, diarrhea. So these were the common symptoms reported in this current outbreak on a person: fever, fatigue, vomiting, diarrhea, and loss of appetite. Any questions? So the rash, the skin rash, they look very red on a fair skin, dark brown on a dark colored skin. Then later they start bleeding, and also in the severe stages they start bleeding from their eyes, nose. When that happens, it's pretty bad. Usually that happens mostly in the severe outbreak in the Africa. Do we have a proper treatment for Ebola? Does anybody know? Right, there is no. So there is no definite or no actual treatment for Ebola as of now. So they mainly treat the symptoms and treat the complications coming out of the infection. Okay? Supportive care means giving IV fluid, giving pain medications, and bring down the temperature. And if they have diarrhea, give the medication, give fluids, and things like that. So there are some experimental medicine. This is one of the experimental medicine. Experimental means it's not still proven. We can use it. It may work or may not. This was one of the medicine we used in United States for the Ebola patients, and it did work. We think it's work, but to know for sure we have to give it to large number of people to prove it. So. Any questions? What's your question? Yes. So there is no FDA approved or approved vaccine for the Ebola. Do you know what is vaccine? Anybody knows what is vaccine? Yes? Yes, that's true. Shot to prevent the infection or the disease to come. What is your answer? Same thing?
So I was going to answer vaccine.
Ah,
I was going to answer vaccine.
you were asking what is vaccine?
Yeah, I was going to raise my hand and call on her.
Okay. Do you have the same answer? Okay.
Yes.
So, your answer to the question, right? How do we protect ourselves from the infection? So, good personal hygiene, that means hand wash, right? Whenever you are exposed to go out or come home, first thing you have to do is wash your hands. You don't know where you touched, what people had, right? That's a key point here I want to tell you today. Hand washing. So wash your hands thoroughly with soap and water or alcohol containing solutions, and do not come in contact or use any items used by anybody who has the symptoms who are suspected of having the Ebola. So that's less likely that any of in this room will have a contact with the people with Ebola, less likely. So these are the personal protective equipment. That means whenever somebody has to be in close contact with the people with Ebola, they are supposed to have the glove, gown and mask and face shield to protect themselves so that the body fluid won't splash on your eyes, mouth or any break in the skin. So this is how the people in Africa, they were handling the dead body, and people who were very sick when they were transporting, they're supposed to cover up the whole body so that they don't get the exposure to the virus. You know that the person who came from Africa and who died here, you know why he died? Comparing to the... Say that again? Yes, he had symptoms of Ebola, but the main issue that his viral load or his infection was so severe, because in Africa everybody hides. Even if they have fever, they don't tell anybody, because if they tell they have fever, nobody will go to their house. Everybody hides. So that he was having so much high viral load and so much infection, that's why he died. We could not save him by giving the medicine we had. So, this probably not for you guys, but whoever in contact with the Ebola patient, there are specific steps released by CDC. You know what is CDC? What is CDC stands for? Yes. Where is it located? The main part, Atlanta. So the CDC has specific steps, how you put your glove, how you put your gown, and how you remove your face mask so that you don't throw the virus upon yourself or on others. So there are specific steps released by the CDC and for the healthcare professional. That means people who are taking care of the Ebola patients. Even the steps, how you put it and how you take it out. Okay. Any questions so far? Thank you. Your question, right?